You're being pushed out?
I'll find a way of getting the board back on side again.
That's dying, Junie.
I don't know what it changes, so.
That's cold, even for you.
Cardiology. I told you I wanted to explore it, but you didn't hear me.
Well, I'm hearing you now.
Here, you're giving us your car?
I need to purge a few things.
There's a detention order against me.
It's been 2 weeks. You said Khalid would only be in detention 1 day.
He could be deported.
Sorry won't be good enough, Dr. Habit. This is your fault.
Mr. Jackson, have the results from your...
You scare him. You see him too, right?
I do.
Good. It's not the mushrooms.
I'll be right back.
Well, the house I bought's in Leslieville. Quick jog to the hospital. Needs a little work. Actually needs a lot of work. You wouldn't have to know a contractor, would you?
Well, my brother-in-law, he's honest, but he's also kind of a moron.
There you are. Try not to move.
So Mr. Lee definitely has gout, but doesn't want to admit it. Well, Mrs. Watson thinks she has everything, but actually just has dyspepsia, and you missed. If you're going to practice, pay attention.
Sorry? She means me. The vein.
The trick is to get him to accept a corticosteroid before he gets a kidney stone. Arnold, you with me?
Yeah, right. Corticosteroid.
Why don't you try tapping the vein, Jake?
Tapping it?
Yeah, tapping it.
Like this. See? Yeah.
She needs antacids and a bland diet for a few days. You got it.
Hey, that was exhausting. No kidding.
Lightweights, both of you. So, I got your text about lunch.
Yeah.
But my sister's actually coming to meet me.
She is? Can I meet her?
Sure. It's okay. But if you thought learning how to put an AV was tough, I mean... Okay, gotta go.
How did you even get in here?
Oh, hey, what's going on?
Hunting party?
We need something to coax him down.
Wait, coax what down?
The model's an acute care surgical response team. It would decrease patient waiting time and expand the scope of procedures that we can do in emergency.
We're not getting it.
Do I want to know what's going on here?
No, it's a bird. We had it and then we lost it.
Shouldn't you be on rounds?
What? I was on my way. We were just trying to catch it.
For patient safety.
Oh, and for our own amusement.
Okay, fun's over. Get maintenance to handle it.
Sorry about the wait. Good news. Landing on a wrist to break a fall usually means a fracture, but in your case, it's just a sprain.
Doc, he looked me right in the eyes, and I swear it felt like he could see through my soul.
Who, the bird? Oh, well, we tried freeing him, but it seems he's trapped in here.
Well, maybe we are.
That might be the mushrooms.
Six-month-old with complex CHD chopping in from Timmins?
Did they say what kind of congenital heart defect?
No, and things can happen fast with infants, Jake, so if we ask for something, do it, no questions asked, okay?
Oliver Campbell, tachycardia 280, stabilized at the regional hospital, but thought it best to fly him down considering his heart history. Second SVT episode started as we were landing. He lost his line in transit.
I'm Dr. Hunter, this is Dr. LeBlanc and Jake Cooper. What's his previous heart status?
He was born with tricuspid atresia. We adopted him at 2 months when he was still in the NICU.
TA is when the tricuspid heart valve is missing or malformed and blood doesn't flow correctly.
Any episodes of supraventricular tachycardia before today?
Nothing like this.
Most TA patients need a shunt put in early on. Has that happened?
4 months ago, they did it here. They hoped that it would hold him over until he gets big enough for the more invasive surgery in a few years.
His little heart's been through so much already. We'll bring his rate down, try to isolate the cause.
1, 2, 3.
17 years old, type 1 diabetes and severe hypoglycemia. Blood glucose is 3 millimoles per liter. Had a glucagon shot on Ruby.
He started slurring his words and passed out. I couldn't get him to eat or drink anything, even though I know that's what I'm supposed to do.
Did you get a hold of Mom and Dad?
We're not related. I'm his girlfriend. And he's emancipated. We both are.
No, we need you to stay outside, young lady.
Rhoda pushed 0.7 milligrams of adenosine.
You have to shock him?
It's just a precaution in case the meds don't work.
No, veins are flat. Can't get a line.
Intraosseous infusion then.
15 millimeter, 15 gauge needle.
Run that down, Jake.
Use the medullary cavity in the tibia as a non-collapsible vein when the patient is critical, but even in a baby this small.
Yeah, when we can't wait.
Will it hurt him?
He may feel it, but we're gonna make it as quick as we can.
I can't watch.
Maybe just go. I'll stay with him.
Dr. Hunter, rates 300.
Syncope, non-responsive.
Hey, Jake, get on bagging. Smaller breaths, thumb and 2 fingers. Squeeze on 1, release on 2, 3, got it? And eyes on me. Locating tibial tuberosity, 1 centimeter below, 1 centimeter medial. Come in.
Decreased air entry on his right side.
That's because of his kidneys?
Large pleural effusion. He needs fluid out now.
60 cc syringe and a spinal needle.
Malik has chronic kidney disease caused by his diabetes.
We told you to wait outside.
And I told you he needs me.
Joni, can you please?
No, please, I need to stay with him.
It's okay. Hey, what's your name?
Ruby Evans.
Okay, Ruby Evans. I'm Dr. Hamed. I'm going to use this needle now to drain the fluid from his lungs. If you're going to stay, I need you to take a deep breath and help him by remaining calm.
Malik, I'm going to move your arm above your head. 1 millimeter to the left.
Can someone please explain what's happening?
We are giving medication to Oliver to help reset his heart rhythm.
Okay. 1, 2.
No change. 1.4 milligrams more, Rhoda.
We thought we were done after we adopted our third, but when we heard about Ollie, we just we knew that he needed us.
It's really admirable taking on a baby with such a complex heart status.
This has been really hard for Gary. He worries so much, but our little guy is a fighter, right?
1, 2.
Give him a second.
Heart rate stabilizing. We'll get him up to CICU. Mags will take you, okay?
Actually, I'll be your resident there too. We're gonna run some tests and sort out what happens here.
Bruce, and thank you, all of you, thank you.
Good job, little man.
Getting fluid now. We'll do some blood tests and get a urine sample to check his kidneys, then assess and make a plan.
We already have one. I'm giving him one of my kidneys.
That's very generous of you, but there are multiple complex tests you'd have to do to...
We did them already. As soon as we learned he had CKD.
Have we seen you here before, Ruby?
Not here. We did blood and tissue typing and serum too. The doctor said there's no way I'd be a match, but they were wrong. Val and I are meant to be. We won't let anything come between us.
Elevated heart rate and a slight fever.
Miss Garcia, I am Dr. Curtis.
Yeah, we've met before. When my fiance brought me in a couple weeks ago. That's right. You had the great story about the jellyfish, right? In Miami. I got stung, and the first thing I said was, "Hi, I'm Sam. Can you pee on my leg?"
Oh, yeah, you just need to rub sand on it to negate the stinging.
That's what you said last time.